Sarah Nadiye, a mother, is among the many maternity patients who have died in Moroto Referral Hospital. Her death ignited anger and accusations of negligence and unprofessionalism against the medical staff at the hospital and the Ministry of Health. On 1st August, Honorable Nakut Faith Leroux, the woman representative of Napak district, narrated Nadiye's situation to parliamentarians and also said the people from Moroto were planning a protest.
Right Honorable Speaker, the matter of urgent importance I wish to raise is about the healthcare. On Monday this week, we buried a lady in Napak. She was called Nadiye Sarah. Nadiye Sarah was going to have her first baby. She died. She was normal, but then she died and left a 1-week-old baby. Nadiye Sarah is the 12th woman we have counted, an elite woman who has walked to that hospital, Moroto Regional Referral Hospital, and has died. We do not count the other illiterate women because we don't know them, who are 80% of the population in Karamoja. That makes me worried at the numbers of women dying giving birth. There are many questions our people are raising which are not being answered. As I speak now, Right Honorable Speaker, the population in Karamoja is planning a protest, and they have put us, the leaders, on notice because of the numbers of mothers who are dying while giving birth. My prayers, one, for the Ministry of Health to review what is killing the mothers in Moroto Regional Referral Hospital, with the possibility of addressing the deeper concern on what is killing the mothers. Particularly, a report on what killed Nadiye Sarah is being waited for because people want that answer. Secondly,
Honorable Nakut called upon the Ministry of Health to find out with immediate effect what could be causing the rampant C-section failures, and also went ahead to demand a report about what exactly killed Nadiye Sarah, pointing out that the ICU section of the hospital is defunct. She called upon government to compensate the family of Nadiye.
Moroto Regional Referral Hospital and other regional referral hospitals in the country should be equipped with functional ICUs. In the ICU, there is an ICU in Moroto Hospital, but it's not functional. So when there was a complication in theater, she was rushed to Mulago. By the time she arrived in Mulago, she died. So if there was a functional ICU in this referral hospital, perhaps her life would have been saved. Number 3, for the Ministry of Health to deploy specialist anesthetists who will supervise that function in every regional referral hospital in the country. We have few regional referral hospitals. It is affordable for the ministry to do that. Number 3, because a life has been lost under circumstances which are careless and the family is depressed, government should compensate that life.
The Minister of State for Health, General Duties Banjarana Anifa Kawoya, then took the podium in response and started by expressing her condolences to the family of the late Nadiye. She noted the high number of deaths among pregnant women, saying the ministry is trying their best to solve the problem, but that adequate funding is the only challenge that is hindering the implementation of better services and hiring specialists.
I do console with the family, and I do take much consideration and pain into what my daughter Nakut Faith has raised on the floor of this house. Mothers dying during the labor time in Moroto or in the country as a whole is not just an issue that can be said and passed as a way that the Ministry of Health is not doing something about it. Right Honorable Speaker, we all know and we are aware that the rate at which the mothers are dying is growing countrywide. It's not only growing that is by the negligence of the Ministry of Health. At times you find that these mothers report late to the facilities. At times you find there are other complications that are beyond our health workers, and in this case, indeed, they tried their best and to refer this mother. It's very unfortunate. But as a ministry, we are trying all our best we can. And when it comes to ICU equipment not being functional, it's true, but still our issue is insufficient funding. As a ministry, we are looking into all of these and to have more ICUs at our regional referral centers.